Hi, I'm Paolo Lanzetta from the University of Udine. I gave a talk to this wonderful meeting in Rome, the eye-core and fluoretina meeting on the correct management of patients who develop large, thick subretinal hemorrhages during the course of age-related macular degeneration. Recent data suggests that about 25 million people with age-related macular degeneration may show new large subretinal hemorrhages, and in terms of percentage, it is thought that about 16 to 17% of patients with this condition may develop this important complication. So there are not officially accepted guidelines on the right way to manage those patients and this condition. We have some positive experience with a surgical approach. One of the first physicians to perform surgery in case of large, thick subretinal hemorrhages due to wet AMD was Golan Peyman in 1991. Since then, many other experiences have been published. Many of them do show very positive outcomes in which patients can improve their visual acuity significantly. Remember, this is a condition in which patients develop sudden visual acuity loss, and if left untreated, they will never recover any good visual acuity. So our approach is a surgical approach with pars plana vitrectomy, mini-invasive technique as we do today with transconjunctival 27-gauge vitrectomy. We do remove the vitreous, we detach the hyaloid, and then the key point of the surgical approach is to inject subretinally TPA. The amount of TPA varies in between 0.1 to 0.3 ml, and the concentration of TPA is usually 0.125 milligram per milliliter. At the end of surgery, after the injection with a very tiny needle, 41 gauge needle, we also inject anti-VEGF. As I said, our preliminary results are very encouraging. If you want to read more on the right approach, depending on the size and thickness of the hemorrhage, you can go to the Vision Academy website, where you can find a nice viewpoint, which is a kind of a consensus document with clear indications on how to manage patients with this condition, either with anti-VEGF or a surgical approach. Thank you very much for listening.